Well, the doctor is in, and today we're talking about breast conservation therapy. New research shows that women diagnosed with breast cancer may live longer with this form of treatment. But what does it involve? What does it mean? Dr. Scott Ackerman is one of the First Coast's leading oncologists. He's here today to talk about the study and what it means for women who have breast cancer. Thanks for being here again, Dr. Ackerman. We appreciate it. So let's dive right into it, because I think there's a lot of people who really aren't sure exactly what breast conservation therapy is. So what is it?
So we use the term breast conservation therapy when talking about the appropriate type of surgery to have for a woman who has breast cancer. Historically, the surgery women would have if they were diagnosed with breast cancer would be to have a mastectomy. We've all heard of mastectomies, and we know women that have mastectomies or bilateral mastectomies. But we found out, well over 20 years ago, we postulated that we could do more with less, meaning that instead of mastectomy, we could maybe just remove the tumor from the breast and then give some radiation treatments and hopefully have the same outcome. And well over 20 years ago, studies were done that took women and randomized them to receive either a mastectomy or a lumpectomy and radiation. And we found out was that by doing a lumpectomy and radiation, that the survival rate, the cure rate was the same regardless of whether you had the mastectomy or the lumpectomy and radiation. And so that's the basis for today when we offer women an option of having breast conservation therapy where they can still maintain their breast and maintain the form of their breast and have less recovery after surgery by having breast conservation therapy.
This is a recently new study that is
so now, as I said, these prior studies that were randomized trials showed that breast conservation therapy was equivalent to mastectomy. Now this new study, this is 20 years ago, so we've been doing this for many, many years. So recently, researchers from Duke looked at data of patients that had breast cancer. What they did was they looked at 112,000 women in California that had breast cancer, early stage breast cancer, stage 1 or stage 2 breast cancer. And about half those women had breast conservation therapy, lumpectomy and radiation, and half had mastectomy. So this isn't randomized data. This is just looking at how women were treated over a 14-year period in California, long-term data. And what they found was something very interesting. They found that the women that had a lumpectomy and radiation actually lived longer and were cured at a higher rate than those that had mastectomy. Now remember, the original trials compared the two that took a woman, randomized one or the other, and showed that it was equivalent survival. But we looked at what happens in real life in this long-term study from or long-term data collecting from California. Those women that had less surgery and radiation died less often from breast cancer, and more importantly, they died less often from other diseases, and heart disease and lung disease and that sort of thing, which is kind of counterintuitive. Because you would think that if a woman was able to undergo a mastectomy, she would be healthier than a woman that had lumpectomy. Well, the opposite was true, that those women that had a mastectomy more often died of other problems.
See, you said it's counterintuitive. That's exactly what I'm thinking, because I think if you eliminate or you remove the breast, then there's a less likely chance that you're going to get, if you're going to just remove everything. So, I mean, it is counterintuitive. So let me ask you this. What does this new research mean now going forward for women who have breast cancer? Are they going to be going away from the mastectomy more often?
No, because there's lots of, you could be very critical of this data since it wasn't randomized data, just looked at historical data. But what it does do, it reinforces what we already know. We're very confident that breast conservation therapy is equivalent to mastectomy for women who have early stage breast cancer. So this reinforces that. We look back at women, 112,000 women is a lot of women to look at. And as I said, the women that had less surgery did better than those that had more. So we know that, I wouldn't go out on a limb and say that it's better. I would just feel confident that when I recommend to patients that a lumpectomy and radiation is equivalent to a mastectomy, that I'm pretty secure in saying that. So women who are concerned about the cosmetic outcome after surgery if they have breast cancer, they don't really have to sacrifice efficacy for cosmesis. And that breast conservation therapy, if they have breast conservation therapy, they can be happy and reassured that they're doing the right thing. I saw a woman, right when the data came out, it was on the national news, and a woman came to me and she had just had a lumpectomy and was ready for radiation. And she was very happy about that news, because it really reassured her that she did the right thing.
Yeah, I mean, because I can imagine it's a terribly difficult time to even think about having a mastectomy or what option should I choose. And I mean, obviously you're going through an emotional whirlwind. I just want to ask you very quickly though about screening and about being your own health advocate. And I know because there's a lot of questions about when you should start getting a mammogram, when you should start, you know, self-checking obviously is very important. You should be doing that even now. But what do you recommend as a doctor when you should start going in and getting these mammograms and whatnot and start being really aware of what's going on?
There's been a little bit of controversy as to what the recommendation should be for mammograms, but I still stand by my recommendation to my patients and to any women that ask me is that once you're 40 years old, you should have a mammogram every year, annually. If you annually until you're old enough that you're sick and you don't think you have more than 5 or 10 years to live, because at that point you're most likely to die of something else. But women age 40 and older should have a mammogram every year. And if you are high risk, meaning you have a mother or an aunt that had breast cancer, you should consider talk to your doctor about getting your first mammogram at age 35. If that's normal, then wait till 40, then continue from there.
With being 40 and the exposure to radiation, I hear some women say, well, I don't want to get one every year because I'm exposing myself to radiation. Is that going to put me at risk of getting breast cancer? I mean, I hear women say that.
Okay, well, two things. One is that the mammograms we do today are very low dose radiation. These are digital mammograms, which have much, much less radiation than the old mammograms did. So the radiation exposure is very, very minimal. Also, you're age 40 now, so there's less development going on. We haven't seen any increased risk of breast cancer in women who get mammograms on a regular basis. And also, pragmatically, women, the recommendation is to get it every year. They wind up not getting it every year, but every 18 months or every 14 months. You know, things happen.
Sure.
And so you're not getting it that often. So I still recommend every year, age 40, the benefits of early detection and the increased cure rate, because your breast cancer will be detected early, far outweighs the risk of malignancy due to radiation.
All right, Dr. Ackerman, thank you so much, sir.
Casey.
We appreciate you being here as always. And Dr. Ackerman, he joins us every Friday. And next week we will be discussing simple ways that you can have more effective communication with your doctor. And for questions regarding today's topic or any other health questions that you might have, just visit firstcoastoncology.com and confidentially submit your questions to Ask the Doctor.